Medical misinformation is everywhere. Dr. Mitch is here for straight talk and to give you the truth.
Let's talk a little bit about physiology, the vagus nerve gut-brain connection. Well, the vagus nerve in the neuroanatomy has many systemic connections. There is a gut-brain axis. The vagus nerve is known as cranial nerve number 10 to remind you it's extensive and functionally diverse cranial nerve. It's a critical bi-directional conduit between the central nervous system and multiple organ systems. Remember, it's bi-directional. It originates in the medulla oblongata. It extends through the neck, the thorax, and the abdomen and innervates structures essential for the autonomic regulation and visceral feedback. Its role is modulating the parasympathetic activity, and it facilitates the gut-brain axis to make it a focal point for understanding integrative physiology, particularly for managing chronic conditions. Now, stick with me. I know this is somewhat complex and it reminds you of textbooks long ago, but it's an important concept, especially in treatment, and maybe we'll do more than one on this particular subject. The vagus nerve comprises of sensory, motor, and parasympathetic fibers, all of it. Its sensory afferents, approximately 80% of the fibers, relay visceral information from the heart, lungs, and the GI to the brainstem. That's right. Efferent fibers originating from the dorsal motor nucleus and the nucleus ambiguus regulate cardiac rhythm, bronchial tone, and gastrointestinal motility. In the heart, vagal stimulation, as you know, slows the sinoatrial node activity and creates a bradycardia. In the lungs, it modulates bronchoconstriction. In the gut, it governs peristalsis and secretion, and it interfaces with the enteric nervous system. The gut-brain axis is mediated primarily by the vagus nerve. Again, bi-directional communication. It's important that you know that, linking the enteric nervous system and the central nervous system. Now, this enteric nervous system has over 100 million neurons embedded in the GI tract, and it operates semi-autonomously, but it communicates extensively with the brain via the vagal afferents. Now, these afferents transmit signals from the gut microbiome, nutrient absorption, inflammatory mediators, and influences the hypothalamic and limbic responses. The pathway modulates not only digestion, but also mood, stress, and things of that nature. Now, one example is dysbiosis. If you have that in the gut, the microbiome itself can trigger vagal signaling. While that will happen, increase cytokines, inflammatory nature, exacerbate anxiety, depression, or even neurodegenerative conditions. Conversely, vagal efferents can modulate gut immune responses, reduce inflammation through the cholinergic and anti-inflammatory pathways. The mechanism underscores the vagus nerve's role in maintaining homeostasis, especially in inflammatory bowel disease, irritable bowel syndrome, and even mood disorders. Now, clinically, vagal tone is measurable, and it's an indicator of autonomic health. The higher the vagal tone, that's the best heart rate variability. It correlates to a better resilience, better GI function. Low vagal tone, on the other hand, is associated with chronic inflammation and psychiatric comorbidities. Now, if the vagal nerve stimulation, whether through invasive devices or non-invasive techniques, like slow diaphragmatic breathing, they'll enhance the parasympathetic activity, reduce cortisol levels, and improve gut motility. Even dietary interventions that support balance of the microbiome, such as prebiotics and probiotic supplementation, can optimize vagal signaling. The vagus nerve has extensive connections and a lot of therapeutic potential. If you target vagal pathways as clinicians, we can address both somatic and psychiatric symptoms, particularly in patients with gut-brain axis problems. And we can do integrative lifestyle modifications, pharmacotherapy, neuromodulation to improve these patients' outcomes, pretty much, again, across diverse conditions. Here's the key takeaway. The parasympathetic nervous system is involved in everything from heart, lung, gut problems, and even more. Without attention, and diagnostically as well as protocol-wise, you're probably missing an important part of helping your patients retain or get optimal health. Thanks so much for watching.